Let's take a few minutes and talk about both FFT and FFT behavioral health. This discussion is going to serve as a brief overview. In the sections that follow, we're going to get into in-depth about the various change mechanisms, the map, how to look at families, how to look at problems, how to look at matching to families as well. FFT behavioral health is designed for families where there's a risk to a child, an adolescent, a young adult, even the caregiver, and that risk includes rehospitalization, involvement in the mental health system, and it involves significant behavioral issues that may impede the family with their daily functioning. Families come to FFT behavioral health oftentimes having been in and out of the hospitals for years, feeling hopeless about figuring out how to navigate either their own, their children's, or their young adults' mental health problems. Or these are families who've experienced their first contact with the hospital system with a recent onset of an acute mental illness. In addition to these kind of broad ideas, families that come to FFT behavioral health also have developmental concerns, substance use problems, maybe undiagnosed mental health issues, co-occurring medical and mental health disorders, among a number of other issues. In a system where families are involved in the mental health system, one of the most interesting things is that understanding the specifics of how mental health problems work, the trajectory of those particular issues and those problems, and the meaning of the various diagnoses they may be receiving from probably more than one person can be a really overwhelming experience. In addition, there is the challenge of ongoing mental health issues to the daily functioning of the family. Remember what happens, not unlike any other family that struggles. There's still issues of potential domestic violence and community violence, aggression, substance use, etc., even juvenile delinquency, and involvement in the child welfare system. Many of the families who exhibit problems like this, and they're looking for help, but it's really difficult for them to connect us up to somebody that can both be supportive and therapeutic in the ways in which they help. With chronic problems, this becomes even more difficult because it's long-term management of something that never really goes away, but something that has to almost be incorporated into the system of the family, so that managing, paying attention to, addressing, and successfully supporting and intervening with mental health issues as they come up over the entire lifespan can be accomplished by a family and a family relational unit that may surround an individual. What do we do in FFT behavioral health? The focus is on helping the family work together. And again, what's similar to FFT and quite different from other approaches is that our objective really is to activate the relational family system to help the individual member get back on track, get back to school, and helpfully and successfully navigate through what's in front of them. For adolescents and young adults with chronic mental health problems, it frequently means that they're isolated, they've lost connection with peers, they've lost connection with school. That further makes it difficult to successfully manage whatever mental health issues they may be struggling with. They typically cut touch with social contacts, with school and work. That increases a cycle of getting stuck in problematic family conflicts. However, by strengthening and repairing relationships, these patterns can be changed, rehabilitated, and disrupted so that not only that individual, but that individual's family system can be more helpful so that everybody involved can not only be knowledgeable of what's coming up, but be skilled and able to take effective action and to maintain that action over time. The families that are involved in the behavioral health system are also families that have the same needs as any other. Help is most helpful when it matches to the way in which their relationships function, the needs that they have, and treatment focuses on empowering them to manage future issues, to manage crises, and to rely on their own ability rather than quickly turning to emergency rooms or hospitalizations for their family member. We have a number of primary goals in FFT behavioral health. First, we want to help individuals and families manage psychiatric, substance use, and behavioral problems. You know, families can learn the skills that they need to be able to manage these very complex things. Families need help in order to understand, in order to know when and how to intervene and know when and what to do to create the kind of stability that's necessary for an individual to be able to manage, to be able to soften, to be able to take part in treatment and manage and implement those treatment suggestions in their daily life. To do so, we're going to educate families to what it means to have a diagnosis and what it means to be involved in the system, and we'll use a psychoeducational approach to do that. We want to help families, young adults, manage the system so that they get the best, the most systematic, and the most comprehensive care that fits their unique struggles. We want to help the family understand that the behavior of the client, whoever that is, a youth, a young adult, or a caregiver, and that because they're actively involved in the system, we want to help the family to stabilize and improve the mental health gains, learning to manage crisis and relapse. Of course, we want to get the individual to take an active role in managing, preventing, getting help with the problems that they have. And we want to help families with the skills in order to manage crises. What we know from the literature is that families that are able to help individuals manage mental health crises typically use hospitals and emergency rooms far less. Now, the fundamental thing we're going to do is to do all this by helping families work out the daily struggles they have. Think a little bit about it. The more families work out the struggles that they have between them on an everyday basis, the more stable the family becomes. The more stable the family becomes, the more mental health struggles are able to work themselves out. So families are a context in which behavior exists, and if we can support that context, make it supportive of the individual, we will help reduce crisis, we'll help reduce hospitalizations, and we'll help families navigate the system better. Now, one of the big things that we're interested in doing is at helping break the cycle. There's an interesting cycle that goes on in the mental health system of diagnoses and treatment and re-diagnoses, medication and treatment. And in many ways, while it can oftentimes be helpful, it doesn't always promote family stability. Our focus is to break that cycle and helps families to be self-sufficient and stable in the future. We've designed FFT behavioral health to focus on a couple fundamental things. One, think about how family stability works. In families that are stable, youth with trauma, youth with mental health issues, youth that are struggling with behavior, young adults that are struggling with the same thing, and children that are struggling with those things. In a stable family, those individuals are protected. Those individuals are helped. Those individuals are supportive so that they can work out those individual issues. It is the family system then that we're going to focus our attention on. Now, FFT behavioral health is intended to be short-term. It's phasic, and the treatment length is only 3 to 6 months. But at the same time, as you can see, family-focused, home-based, and intensive, with a focus on stability, healthy functioning, integrating case management to help families learn to navigate the system, and the management and assessment of domestic violence, substance use, and other activities that are risky. And what we bring together in FFT Behavioral Health is not only an evidence-based family treatment that does these things, but we also bring a systematic approach to helping families manage the different things that they need in practical terms every single day so that we can help extend treatment beyond the therapy hour and help families overcome practical needs so that they can absorb and take the help that we and other community resources are helping them with. Integrating specific case management to help families navigate the mental health system, navigate the child welfare system, only helps promote mental health. It only helps promote family stability, and it only helps promote individuals getting better and being able to have long-term management of struggles that they might experience. We accomplish this by integrating, as I said earlier, 2 primary things. First, functional family therapy is a family-based change model that begins with engagement, helps families work things out on an everyday basis, and helps families maintain those changes over time. It's an active system, and our focus is going to be on helping families be active in system navigation and in management of what goes on around them so that they can be in charge of the care that they get. We're going to help focus on practical issues that may impede the family's stability so that they can absorb and they can take in and translate into action the suggestions, recommendations that they're getting. We're going to give psychoeducation about medication, mental health care, and mental health systems. And we're going to integrate working with the stakeholders around the family to support and promote the family as the central player in their treatment. Now, what that means is that FFT behavioral health therapists are very willing to meet, to go to meetings, to help understand what's going on in psychiatric and psychological care so that they can help bring that to the family. We are going to, both at our baseline measurement and our discharge measurement, we're going to do systematic assessment of mental health issues in order to help identify what needs the individual and the family might have. And along the way, like all adaptations of FFT, we're going to do evidence-based treatment planning to promote good, active, purposeful treatment that has good outcomes. So behavioral health is a broad term. It's a broad term that looks at taking a holistic approach to an individual. Now, the reason that's important is because the impact of untreated behavioral health conditions in the U.S. is staggering. Prevention, early detection, and treatment of behavioral health conditions can lead to not only individual improvement, but family and community health improvements. Treatment in a systematic behavioral health way can produce outcomes that go well beyond mental health, but also include physical health as well as behavioral health and behavioral improvement. FFT brings a really unique perspective to behavioral health. It brings a family relational focus. FFT Behavioral Health is built on FFT, and it provides a relational pathway so that you take a family system and organize and help activate that family system to help an individual. So we bring that family focus to chronic mental health, justice, and welfare involvement. And as a family systems approach and a family therapy approach, we use the family as the primary entry point into both assessment and intervention of issues. By building family support and family functional management of behavior, we can reduce out-of-home placements, hospitalizations, and emergency room visits. Now, we have anchored FFT behavioral health in the core evidence-based mechanisms of FFT. What's important about that is that's what makes FFT behavioral health an evidence-based program. And we've done it in a way, so we've tried to help support individual mental health, psychiatric providers who may be working with the family. It's delivered in a way that matches to the characteristics and needs and values of that unique family. That's a characteristic of all FFT approaches. It's delivered in-home by people with master's degrees or equivalents. They're specially trained and they have knowledge in mental health diagnosis, medications, and how to fit mental health disorders to the FFT model. Each of these therapists take an active role in helping the families and the individual navigate the complex mental health system. And what that means is the treatment is delivered not just in, quote, traditional sessions, but in everyday activities of helping going to appointments, helping support families, and providing case management to help them navigate the system.